The next of the spiral-shaped organisms that is high yield for the USMLE Step 1 is Borrelia. Borrelia burgdorferi is the causative agent of Lyme disease. It's probably one of the leading tick-borne illnesses in the United States, so therefore that makes it fairly high yield. It is fairly difficult to culture, and diagnosis of Lyme disease is somewhat difficult. A lot of the times it's based on clinical presentation, especially in primary Lyme disease. So the species is the burgdorferi. There are other species in the genus that can cause Lyme disease, but most often they're going to ask you about Borrelia burgdorferi. Now, what are the reservoirs? Okay, the reservoirs. Where does this hang out? It hangs out in mice and deer. How is it transmitted? It's transmitted by ticks, so that's the vector. Now, we've talked vectors already. We talked ticks for Francisella. We talked fleas for Yersinia, and now we're back to ticks again, okay? What type of ticks? The Ixodes ticks, and it's a good idea that you know the species of tick, because when we talk about Rocky Mountain spotted fever, we're going to be talking about the dermacenter tick. So the transmission is by an insect vector, and it's a tick. Remember, that's important. When do you think this is going to be a predominant illness? Well, it's very common in the northeastern part of the U.S., and it's in the spring and summer and early fall when most of the people are outside walking around and can get a tick bite more easily. You're not going to see this, in other words, very commonly in the winter. Pathogenesis for Lyme disease goes back to the insect vector. You get bitten by a tick, it injects the organism directly into the blood. And from there, it can go to any number of different target sites. It can go to the heart, it can go to the joints, it can go to the nerves. One of the things you'll see commonly later on in Lyme disease is that you get what's called a migratory arthritis. And that migratory arthritis is typically due to the formation of immune complexes. So we're going to look for that when we talk specifically about the different stages of Lyme disease. So Lyme disease, as you can see here, big bold print, number 1 vector-borne disease in the U.S. What are the symptoms? Well, we know we have flu-like illness. Is that going to help you out with diagnosis? Probably not. What is, though, is the rash. Remember, the rash is the classic bullseye rash. Are they going to mention on step 1 about the bullseye rash? Probably not. That's a really overused buzzword. They know as soon as you see bullseye, you're going to know exactly what it is. So now what they're starting to do is they're starting to describe those buzzwords. So how are they going to do this? You're going to have an individual is not feeling well, they have flu-like illness. They come to the doctor, and the doctor sees what's known as a spreading annular skin lesion. They may go into more detail, saying that it's more red around and clear in the center. You're going to have to pick that up, that what they're telling you in more words than just bullseye is that you're looking at a bullseye rash. Now, they'll probably mention the rash because it's seen in the majority of cases. When it's not typically seen is when you have somebody maybe that lives alone, maybe they get the tick bite on an area of their body that they just don't typically have access to, like maybe the back of their shoulder, for example. So they'll have joint pain, flu-like symptoms, and the bullseye rash, and that we would call one of the primary stage of Lyme disease. Once that disseminates, all right, you start getting the neurological symptoms for Lyme disease. And what's very, very common that you have to be able to associate with Lyme disease is the development of Bell palsy. Bell palsy is when, I like to describe it as this: you wake up in the morning and half of your face doesn't wake up with you. So half of your face is moving and the other half says, I'm not ready yet, I'm not getting up. Very, very common with Lyme disease. We actually have a friend who lived by himself in Albany, New York. He got flu-like symptoms. He had the bullseye rash, but didn't see it. finally went to the doctor when that very thing happened to him. He woke up in the morning, but half of his face stayed in bed. So one half of the face not moving at all, the other half perfectly fine. And I know you've seen patients like that before. You got to associate that with Lyme disease. It can also go and target the heart, so you can get arrhythmias and myocarditis and pericarditis as well. Now, some of the late symptoms of Lyme disease are the arthralgias and the migratory arthritis. So you definitely see this once the infection has gone on for at least probably about a month or so, up to about 2 years. You'll get the migrating joint pain and the arthralgias. How are we going to diagnose it? Well, again, it's difficult. And the reason it's difficult is because serodiagnosis isn't really the best. You get a lot of false negatives, you get some false positives. So a lot of people are actually missed. You know, they may have Lyme disease, and a lot of these patients are seeing rheumatologists. You can use Western blots or DNA analysis for this, molecular analysis, but it's just not highly used because, again, a lot of these patients get a false negative. They're not really sure what it is. Do you necessarily know to go to the next step to look for Lyme disease? So a lot of those really aren't utilized as much as they probably should be or could be. Treatment for Lyme disease is doxy, typically is your drug of choice there. For secondary, now, of course, when it's really widespread through the blood and it's causing Bell's palsy and it's causing arrhythmias, you're going to use ceftriaxone, and you can use doxy or ceftriaxone for the arthritis. Prevention of vector-borne diseases go back to control of the vector. So preventing that bite in the first place is the best mechanism of prevention that we have. There is a vaccine for Lyme disease, but we're not currently using it in the U.S. So as far as protection, it is not one of the things that we routinely give in the U.S. So it goes back to the fact that Lyme disease is the most prevalent vector-borne disease in the U.S. So vaccine in this case, probably not so important for step one.